Hey everybody, it's Matt Chu from Upright Health, and today Josh and I decided to switch. He's going to be
I'm seeing very clearly today.
I don't really know even where the camera is. This way?
Yeah.
That thing? The glowing thing.
Yeah.
Okay, so today we got a question from a William, who's a YouTube viewer, and William actually asked, are you still there?
Right here, man.
Okay.
All right.
Okay. He had a question about his forearm and wrist pain. So to sum up his history, he's had wrist and shoulder and neck pain for, I believe, it's about 3-4 years, and every year the pain kind of spreads. So it goes from the hands and up to the shoulder, and now it's gone down into the hips. And recently, the most recent visits to his doctors and physical therapists basically resulted in him being told, well, you have kyphosis, which is this position. Am I facing the right way?
You're good, yeah.
Okay. So kyphosis in a high right hip, so kind of like this. And so William's question was, do you think these things are in some way related to the issues that I'm having with my wrists and forearms and all this other stuff with the shoulders and hips? How does all that stuff work together, or is there something else going on? So I'm going to throw it to you, Josh, wherever you are. What do you think about this?
Well, it's a great question, right? And I'm sure it's very frustrating to be dealing with this for, I think he said 4 to 5 years, so
yeah,
quite some time. So I just wanted to give a little story about a client that of mine that we've had here at Upright Health. And he kind of had the same type of symptoms as you. He had lots of forearm pain going on, all the way down to his wrists, and then all the way up to the shoulders, neck, back stuff as well, right? So all the stuff in the book, right? So just to give you a general idea of how he's made progress, and it's been about a year now of him training with me, and he is the majority of the time pain-free, right? He still has little setbacks, but he's doing really well. And I think one of the biggest things for him was honestly just getting on a program and working with someone that knows movement a little bit, like myself, right? So, so basically my point is that while he was having all these issues, he was just inactive. He wasn't doing anything to try to fix besides he was doing like massages and stuff, right? Which that would give him some temporary relief, but never long lasting. Everything comes back within a day, 2 days, whatever.
Right.
So just the simple act of him getting into the gym to do sessions once or twice a week and really working on just some total body strength, mobility, and things like this are really, like, over time, his symptoms started gradually going away, right? He stopped having the back pain. His forearm started to clear up and everything. So that's kind of just some practical, cool concept right there of, hey, maybe you just need to start doing something and getting yourself out there and being a little more active.
Right.
Now, just to give some specific things of what we were doing is we were doing lots of full body movements. So we are doing deadlifts, push-ups, squats, rowing motions, right? Things to strengthen his shoulders, strengthen his core, and strengthen his hips, right? But then also to maintain him being able to do all that is we were also having to stretch, relieve the shoulders. We were also having to do some tissue work on the forearms and the shoulder area, so he could sustain this level of training, right?
Yeah, so I think one of the important pieces of William's question too is how can these things all be related to the discomfort in the body, and particularly with like forearms and wrists and hands and elbows. I have a lot of unfortunate personal experience with a lot of discomfort in the hands and wrists and forearms and shoulders and neck. So I'll say personally and professionally, I've seen this happen a lot. There's plenty of theories about what's going on, and I think the simplest explanation is basically when you're doing this, as far as the symptoms in your forearms go, you are choking off the stuff that feeds your hands. So when you're in this kyphotic position, your shoulders are often rolled forward, and there's a little space here where the blood vessels and the nerves travel through that gets closed off when your shoulders are rounded forward. It also changes the way the muscles down into your arm function, because you suddenly have a different angle that these muscles are operating at, and they no longer are able to operate without excess tension. Excess pull is the best way I can describe the internal sensation. So one way you can actually test this is, if you're somebody who wants to test this, you think I'm totally full of it right now, you can go ahead and just get yourself into a kyphotic position, grab some dumbbells or something heavy, and then just do a bicep curl, and then go ahead and get into a better position, and then do a bicep curl, and then see what that feels like in your arms. And what you'll tend to notice is that it just doesn't feel good to do much of anything when you're in this position. If you're kyphotic and you go and try to abduct your arms, you try to raise your hands out to the side, what you'll notice is there's generally going to be some excess tension going into your arms. I actually feel tension right here into my elbow as I come up, and this is about as far as I can comfortably go. I can go further, but it's going to require me to override a natural internal sense that I should stop. If I'm standing without that kyphosis and I raise my arms, it's really not a problem at all, even up here. But again, kyphotic here, I'm already running into problems. I have muscle constriction up here. I've got tightness all in here. So all those things very immediately and obviously contribute to discomfort in motion. And over time, if you're always stuck in this position, you're probably not going to feel so good. As far as the right hip hike, the same principles apply, right? If your pelvis is being held in an awkward position, you have all these muscles that are now working in an imbalanced way, and that's probably not going to feel great, right?
Yeah, for sure. And that's a great point. And I think that we've both worked with people who work at desks, and you'll see if maybe they have to miss a week or something like that, and they've been working a lot. They come in and everything's hurting because they've been in this position for so long, right? So, if you are having this kyphotic position, there's probably a reason that you're in that position. Maybe it's because you work at a desk. Maybe it's because you just hunch over and play video games or whatever. But if you're in that position more and more, then that's just going to be leading into your dysfunction. So finding a way to get yourself out of that position and better body awareness is going to help you a ton.
Yeah, for sure. So there's a lot of different easy things you can do. We have a couple videos that you can look back at. We just recently did one for a pretty low impact kind of exercise to help you with kyphosis. You can go check it out. We'll post the video right here, so you can click that thing and go right here. And we also have an older video that's a little more aggressive. It may not be appropriate for you. Some of the things may not be appropriate, but kind of choose based on what you can handle. Also, there's things you can do with your shoulders, right? So there's like retraction exercises you can do. So once you've kind of worked to get your kyphosis to be a little bit better, you can work on shoulder control, things like that. There was a video that we put up a little while ago also showing a stretch just up here. And I think there was one with a tennis guy, right? There's a guy who played tennis that we talked about a bunch of different shoulder things that you can do to try to open up this space in the front of the shoulder to help make sure you get good shoulder function and blood flow down into your hands. Was there anything from Greg that you wanted to show, or any specific exercise?
No, I think just that one that you just pointed out, and I think that you were just telling me that that's cleared up some stuff in your wrist, just simply getting this kind of region back to where it should be.
Right.
Down regulating some of these muscles that are going to be tight if you're kyphotic.
Yeah, so for a while I've had this left wrist was bugging me, and it was taking me quite a bit of time to kind of figure out. And I did a bunch of things around my shoulders, but I just couldn't figure out what it was. I could tell it was going from shoulder to wrist. I could just feel tension in funny ways. I'll probably make a longer video about this, but basically just trying to find a way to stretch it kind of like this. You have to be careful with this. You need to pull the shoulder back and then just feel for a stretch through the front of the shoulder. you just go slowly, as with any stretch, just slowly trying to get that to release. I'm kind of in an awkward kind of half lunge position, but if you do this on like a desk,
Sure.
if I do that somewhere, here we go. So I could use like a piece of furniture just to go like this. This makes it a little bit easier.
Get a buddy to stretch with.
Get a buddy to pretend they're pregnant and just stand behind you. So you can just get your hand up like that, and now I get the stretch going basically from the anterior deltoid and the biceps tendon, and just going straight down into my forearm, and it feels really good. There's a bunch of tension there that builds up from doing all kinds of other exercises, and what I noticed was that the tension would actually build up there a lot from doing computer work, because your arms are parked right here, and you're using that biceps tendon, the biceps muscle, to kind of help you maintain this position, and it just gets all cranky and foreshortened, and it needs a little bit of help to relax. This stretch feels phenomenal. So really, 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 really helps with wrist stuff to just get the shoulders open a lot. So William, I hope that this is something that you start poking around, start working with. Starting when I was 19, I had tons and tons and tons of wrist and hand pain, forearm pain, elbow pain. I used to get some pretty loud, severe snapping in my elbows, and my hands would go numb and cold. Nothing passive ever worked for that. Doing massage and all that, like you said, it helps for a little bit, but then ultimately you actually got to figure out how to keep things stable and healthy and keep blood moving through there. So definitely check out some different
I can give, just to make this video like 20 minutes long instead of
I wanted to go for 30 today.
just personal experience with myself, just to run off what Matt said, is anytime I've had wrist pain or elbow pain, like when I'm pressing or bench pressing or anything like that, it's always been, what has helped it alleviate has always been actually, getting more stable at my shoulder joint, right? Because the shoulder feeds everything. So I think that was kind of the point of the video, is look upstream. Don't just go for massaging where the symptom is. Look at the shoulders, at the rounded back, to see if we can kind of make that a little bit more functional and get some results there.
Yeah, it actually reminds me, if you're looking for a way to some easy exercises to kind of help you get that kyphosis out, if you just want like a simple to follow plan, we also have on the website, we have the sitting solution, and that goes through a lot of easy exercises, beginner exercises to kind of help you get your upper back to straighten out a little bit. So you can check that out at uprighthealth.com. So William, hope that all helps you out. Hope this video was at least 25 minutes, and I hope you remember that pain sucks.
Life shouldn't.